It's Dr. B and Elizabeth too, coming to you from Idaho. We are ready to rock and roll today, giving you everything we can regarding the spinal galant reflex. Say hello to everybody. Happy June Tuesday. So anyway, we're going to bring you some fun things to think about as amazing chiropractors out there trying to change the world. So let's hit the slideshow. What do you say, girlfriend? Let's do it. Let's slide away. All right. She's going to go take a nap while we chat. Cool beans. So here we go. Part 5 of our amazing primitive reflex series. Let's rock and roll, everybody. First of all, I want to, as always, thank ChiroSecure for being our sponsor, for being an incredible part of the chiropractic profession, and giving us this platform and really having our backs, when we really need them. So thank you, ChiroSecure, for giving us this opportunity. So let's dig in a little bit. We are, again, on part 5 of our series. We've gone through Palmer, Rooting, we didn't do Babkin, Morrow, tonic labyrinthine, and we are on spinal galant today. Where traditionally, again, we like to see our reflexes integrate the spinal galant about 3 to 9 months-ish. That's a pretty big window. But what we want to do here is give you really clinical pertinent pearls. Say that, pertinent pearls, clinical pertinent pearls, for you to start adding to your practice. Now, whether you want to do reflex work or not, that's, your bag of chips, if that's what you want. However, we should be mindful of being able to assess these and know the neurological consequences from a chiropractic standpoint of if they're still too active and hanging out. So we used to, again, say reflexes integrate. Basically, again, they're the roots of the nervous system. They should quiet down, not be active or persistently active past the age of 1 year. Keep in mind that in times of stress, trauma, toxins, our thought patterns, technology, tethered restrictions, including subluxation that causes tethered restrictions, tension, torsion, and the terrain, environmental terrain, internal terrain, and external terrain that we are exposed to, all will create stress, which can A, not allow these reflexes to integrate, or B, reactivate them in times of increased stress loads. So the spinal galant, it integrates again about 3 to 9 months, somewhere between there. Again, reflexes rely on movement patterns. We need to go through these movement patterns in order for these reflexes to integrate, to not be persistently active. And this particular reflex is associated with a rolling pattern, which we'll get to in just a minute. So it is important in the birthing process, like the ATNR, the asymmetrical tonic neck reflex. It's important with regard to helping the pelvis corkscrew and engage basically in the vaginal canal for baby to descend for optimal birthing position. So we want this to be active and engaged in utero. It is important. It is a gross motor. It's going to be important in gross core. Again, core stability comes on before fine motor, gross motor before fine motor. So this is going to help our balance and our coordination of body parts. It helps us progress to rolling, to creeping, to crawling, and to walking. So it is associated with three, not two, I know my fingers, 3 major sensory systems, as we've talked about before. And go back, feel free to go back either to the Intersect for Life Facebook page, Intersect for Life Educational Seminars Facebook page, and or ChiroSecure Facebook page to look at old versions at the beginning of the series that we've been doing. So every reflex kind of represents the maturation of sensory system, sensory motor systems. And in this case, we're looking at auditory, tactile, and proprioception. So the spinal galant reflex, if it is not integrating, it stays persistently active. These three sensory systems may be problematic. Sensory motor systems may be problematic. Okay. So in the little fiddle fart, what we do is we, have them prone over on mom's belly, over our pregnancy pillows, over a boppy, whatever, and you are just merely stroking, just lateral to the spine. And what we're looking for is I always tell when I've been teaching, I really brought this work forth to the chiropractic pediatric profession over 20 years ago. And when I would teach with the ICP, I would say it looks like a horse flinching or a cat kind of flinching when you do the stroke. So you can look for even a mild sign of just this flinch on the skin to a more marked finding. So a flinch would be just a mild, persistently active finding versus an actual lateral flexion. We actually see the thoracolumbar region laterally flex. That is a more marked or more actively persistent spinal galant reflex. All right. So little fiddle farts, easy. The older child, you simply have them on all fours, and you can take your fingertip. You can take a paintbrush. In this picture right here, you see the brush that is in my reflex hammer. And we just start at the scapular border and stroke just a half inch or so lateral to the spine. And again, in this picture, you can see where she laterally flexes to the right. Okay, so the more it mimics a very infantile reflex, the more active it is, okay, the more persistent it is. So again, in the up to 9 months ish, if you see it active, it's not a freak out point because they are primitive reflexes that should be there in that infant. However, if you're getting into 9 months, 10 months, and you see it persistently active, that's where a concern comes in. So what motor movement patterns do we want to engage this little fiddle fart in order to help this reflex integrate? We want to don't think from let's intervene when it's past the point of quote unquote normal. Let's shift our mindset to a preventative mode, meaning we want to optimize optimal neural development by being proactive. And so what motor movement pattern is that? That is a rolling pattern. So hold on, we'll get there. If it stays active, what we tend to see with this particular reflex is bedwetting, particularly enuresis during the day. And some feel that is because the kiddos are wearing pants, especially jeans or so forth, that are a little snug around the waist, and that may activate that reflex. So past the age of 5, if you see persistent bedwetting, this is only one of the potential causes. All right. There's many reasons we can do a whole thing on enuresis. Poor gross motor, but again, you have poor gross motor, you're going to have poor fine motor because gross motor needs to come on board for it first. These are often kids that are said to have ants in the pants. They can't sit still. They're fidgety and ants in the pants. Okay, so trouble with paying attention. They get misdiagnosed with behavioral issues, with ADD, with ADHD, etc. The spinal galant, as with the 18R as well, is associated with scoliosis. So what you may tend to find is if it's persistently active on one side, you may see that lateral curvature drawn to that side. So you can get a lateral curve or an outright scoliosis if it's left unchecked. Concentration, coordination, poor posture. Again, these gross motor milestones. We know that poor postural stability is associated with a number of labels: ADD, ADHD, autism, you name it. All right. So it stands to reason that we're seeing this. So what do we want to do to help it integrate from a proactive standpoint? Segmental rolling movement patterns. That's one that we're going to really focus on. You might have seen that one of the exercises given for the persistently active spinal column is snow angels. But let's talk a little bit. We want to do those in kind of a specific manner. With little fiddle farts, you can start with engaging while they're supine, engaging both arms to move at the same time, and you do that. You do the movement. Actually, the adult caregiver does the movement. Both arms, both legs, right arm, right leg, left arm, left leg. Do that. If the caregiver is doing it very slow and controlled, so that both arms are coming out and together in the equal, accurate timing, and both legs are. In the older kiddo or the adult, what you want them to do is you'd want them, again, to do it slow, controlled. I say that their extremities they should pretend that their suction cup are glued to the floor. We don't want floppy movements and where their arms and legs are up off the floor. We want very slow, controlled, snug to the floor movements. And you have them start with all extremities, arms and legs, out and then in, out and then in, 3 to 5 times. And then have them just do one arm at a time, both arms together, one leg at a time, each leg separately, then just the right arm and right leg and left arm and left leg, etc. Very slow and controlled. Okay, so those are snow angels. We don't just want them out there flopping, okay, and doing snow angels. In your little fiddle fart, in your baby, what you want to see is you want to see them being able to roll on their side and stay on their side a little bit and laterally flex their head up and stay there for a little bit. And maybe you have the parent on the other side, the caregiver, doing some eye-to-eye social contact, looking at a toy, so forth. Again, it's that lateral flexion movement that you're looking for to engage. So these are some things that we want to do to be proactive, as well as to use if you see it persistently active. Well, think bigger. Teitelbaum, this is a big paper that's been out there for years, and you're hearing more and more about it. What he looked at, and this is why you might see that an abnormal rolling pattern is associated with autism. I don't want you to get hung up on if you see this, that automatically says that child has autism. Let's not go there. Too early in the game to even determine. We need to understand that poor motor milestones are associated with a number of labels. But poor movement patterns is showing you a window into their neurological integrity, their brain development. And looking at rolling, that is a movement pattern that we want to be mindful of. We should have a corkscrew rolling pattern from about 3 to 4 months ish. You start seeing that corkscrew pattern starting from the pelvis and rolling through the pelvis, corkscrew through the trunk, and then the shoulders follow. At about 6 months, you start that corkscrew rolling pattern with the shoulders through the trunk, and then the pelvis follows. So we want to look for this corkscrew pattern versus the picture here where that little fiddle fart rolls over onto their side first and then kind of flops as a whole unit, like a whole trunk. Okay. We want to be mindful that that's something we want to be proactive of. And what we can do is we can foster proper segmental motion. And let's see if this video is going to work for us here. Maybe not. Okay, we will hang on a second. For some reason, my video is not rolling today, but what we want to do is you can have them supine. If I'm going to have this little fiddle fart rolling from right to left, I would put a slight tug on the right, slight tug on the left leg, bend the right knee of a little fiddle fart, and just start to engage them in a little bit of a roll through the trunk, and let them kind of sit there for a while. Hang on, let me see if I'm going to switch here for just a minute. So I would have Elizabeth, let's say I want her to get rolling this way. I would tug on her left leg, bring her right knee over, and just let her kind of sit there a minute. And then when she's ready, she'll engage and roll all the way over. Let them do the work. Okay, let the little fiddle farts do the work. And you would do that to both sides. We want to engage rolling from both sides. Okay? Cool Beans Cafe. And the same thing we would do from prone to supine. And we've showed this to you before in various other classes that we've done with ChiroSecure. The other thing that's a great way, so integration maneuvers, we talked about snow angels, we talked about segmental rolling, and this is a great one. I call it squishy bug and stretchy snake. That's what I tell. So what I do is have them lie on their side. If they have scoliosis, let's say the lateral curvature is to the right, I might do 8 reps on the right and 4 on the left. Okay, so I have them lying, side lying, putting my hands on their hip and their shoulder, and I am squishing them together. Okay, so squishy bug, I'm squishing their shoulder and their hip together, and I'm holding for like a count of 10. And then the next time I will be pushing them together, like trying to flex them together, and I ask them to resist against me. And they have to push against my hand here. They have to push their shoulder superior and their hip inferior and push against me and hold for a count of 10. It's basically like an isometric contraction that I want them to do. And then I'll roll them to the other side and I'll do the other side. And then I will cross my hands and we'll do stretchy snake. So this is squishy bug. I'm squishing them together and they're initially not resisting, and the second time they're resisting. Then I'm having them do stretchy snake, like I'm stretching them. I am crossing my hands. One hand is on the hip, one hand is on the shoulder, and I am just stretching them out. Hold for a count of 10. And then I'm keeping that position and I want them to try to resist against my hands, basically trying to laterally flex their trunk against resistance of my hand, hold for a count of 10. So I'll actually do this maneuver, then this maneuver, then roll them over, do the other side. And then let's say there is a scoliosis on the right side, I will just lie them for the last extra 4 on that side. I will just have them face up and do extra on that. side. Okay? So squishy bud, squishing them together, and then stretchy snake, stretching him. Again, you're stretching that core tone. What I have found with spinal galant is I use a nervoscope, and this is just clinically what I found over the years, is that when I scope them, I will often find the break at the point of subluxation, and I will often see that's when it also elicits a spinal galant response. So it's not, 100%, but what I want you to think of is if you use any kind of nervoscope or any kind of instrumentation, and you see especially the thoracolumbar junction, L1, L4, those are big areas. If you see that spinal galant reflex start to become activated at that point, you will often see the subluxation there as well. So just kind of keep that in mind as well. So that is some awesome information about spinal galant. Hopefully this was very helpful for you. We will, well, this one might play. Here we go. This will pull it all together for you. We're going to do we're going to be a puppy this way. Okay, fabulous. Okay, we're going to get on our hands and knees just like that, like a puppy. Okay, is it okay if I lift your shit up just a little bit? Okay, puppy dog. All right, so with the spinal galant, we can use our fingertip and just start mid-scapular region and down we go. Okay, and so we're going to check that paraspinals for that lateral flexion or the paraspinal muscles twitching like that. Okay, that would be a positive spinal galant. Spinal galant is associated with your tactile, auditory, and proprioceptive systems. A lot of people forget the auditory part, and it's actually through the vibrational sense that comes up from the CNS, from the spinal cord to the CNS. Okay, and that's the spinal galant. Okay. So if we have a positive spinal galant, it can contribute to scoliosis, and we often see enuresis past the age of 5. Lots of times during the day, the wedding, and that's because the waistband of a lot of pants come about the level that that spinal galant gets activated. So a couple things we can do. Can we do some squishy buds and stretchy snakes? Sure. Sure. Okay. So you put them in a sideline position, and we just are taking the hip and the shoulder and squishing together, kind of into that spinal galant pattern. And we hold it, and then we can do a stretchy snake, where we take and we're doing the opposite, hands are crossed. And I don't remember. You remember those, and they're stretching about. So we're going to do squishy bud. Hold for a count of 10. And stretchy snake. And you're just elongating that. Good job, Al. And sometimes we do that in the beanbag chair to make it easier, huh? Sometimes if they have a, you want to try it in the beanbag? All right, here we go. Okay, and you're going to do 3 to 5 on each side. So now we're going to do the other side. We're going to roll this way now. Okay, ready? Okay, squishy bud, squish it together. Awesome. And stretchy snake.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good job. And that will help with the spinal galant. Okay, for a little fart. Okay, we can check. You want this up? Good job. Okay, we can do the spinal galant anywhere, anyhow. Listen to that. So I can have him lying like this. And again, okay, so you'll see him. All right. So still a little bit present on here. So I would do the same thing with him that I do with Allie. Give me here. Oh, boom, 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 boom. And we're gonna do squishy bud, squishy bud, squishy bud, squishy bud. Ah, stretchy snake, stretchy snake, stretchy snake. Ah, it's awesome. Hold for a count of 10.
Do 3 to 5 on each side. Boom, 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 boom. Hi. Ready? Stretchy bug. Okay. Okay. Squishy bug. 3, 4, 5, 6, 7, 8, 9, 10. Stretchy snake. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job! Yay! Good job! And that's a spinal column and a little part.
So there you have it. Squishy bug, stretchy snake. In those videos, I did not have them do the resistance, but you can have them do the resistance, the isometric resistance in the stretchy bug and the squishy bug and stretchy snake. Oh. So there you have it. Enjoy this. Again, I want to thank ChiroSecure for giving us this platform, and use this information. Go out there, keep changing lives, keep changing the future, and turning the tide for those generations to come, because they need us more than ever. And you will see Eric Walke back here on July the 1st, Thursday of July. We're hitting that already. And I'll be back the 3rd Thursday of July to bring you more entertainment and fun. So from me to you and Elizabeth too, we want to wish you an amazing 4th of July, and we'll see you in July. Boom.
Today's pediatrics show, Look to the Children, was brought to you by ChiroSecure.